The Sherlock Holmes of Health is in. Let's welcome back Dr. Elizabeth Rodgers, who's here to talk about a healthcare system that many people are feeling failed by. Why is that?
You know, it's so interesting because despite the fact that we have one of the richest healthcare systems here in the United States, we have one of the most unhealthiest populations. And there's so much data that illustrates this because unfortunately it's not a novel trend. Some of our most recent data that I find the most disheartening is that the life expectancy here in the United States is now nearly the lowest it's been in nearly 2 decades. And 6 out of 10 Americans are living daily with at least one chronic health issue.
And why is this? Why?
And that is disturbing, isn't it?
Yeah,
at least one. And the reason we have to say at least one is because a majority of those people are walking around with 2 or more health issues. So what is the problem? You know, the part of the problem is that doctors aren't actually trained to heal. They're trained to manage symptoms. And I have taught in medical schools and I'm very familiar with that curriculum. And getting a diagnosis and being healed are 2 very different things. Another part of the problem is that as individuals, we've had our power taken away. We've been trained to give it away to doctors. And, you know, to be clear, doctors and prescriptions absolutely can and should be used when they're necessary. But people don't have a decision-making framework to know how and when to even best utilize them.
Well, let me say this, because here in South Carolina, you know, we've got a lot of rural areas, so there is a lot of lack there of access to healthcare providers and so forth. I think that various healthcare providers, they're doing better at getting out there, reaching out to people. And there's lots of organizations, we've talked to them, we've had them here on the program, about how they are doing whatever they can to bring it to them. But with all the information that's out there, with access to all the information that's out there, why is it that people are now finding themselves higher rates of diabetes and heart disease and you name it? I mean, so many chronic illnesses.
And what's disturbing is a lot of those chronic illnesses, cardiovascular and heart diseases, to name one, are largely preventable and reversible conditions. So again, we have this system that's trained to manage symptoms really well.
So would you say that the healthcare industry needs to create more of a culture around how to just live a healthy life?
Yes, I think we need to do 2 things, at least 2 things, in order to move from simply being diagnosed to actually being healed. First, we need to train doctors to identify root causes of symptoms and create pathways for people to heal rather than merely managing them with diagnostics and prescriptions. We really need industry-wide changes at a system level. I'm talking things like changing our medical school curriculum, changing the way we are training our healthcare professionals to deliver care. Because there are a subset of people who are perfectly content managing their issues, but there are also, I believe, a growing number of men and women who really want to actually heal, who are willing to dive deeper and explore those root causes. So the other step we need to take is that as individuals, we really need to take personal responsibility for our health and well-being.
Well, I was just going to say that because you can't wait for the healthcare system to come around. You need to take charge of yourself right now. You know, we've had an MD on this program who is also an expert in holistic care. So he sees it from both angles.
Exactly.
So would you say that more doctors coming up through the ranks really need to have both Eastern and Western philosophy?
Yes, and you know, I've been on the show with you before and we've talked about important questions to ask of our practitioners, and that is another one I would encourage our listeners to be an advocate for yourself. When you go talk to practitioners, ask them, you know, hey, when you address health and healing with me, do you integrate Eastern and Western approaches? Because what you're getting at is that health is actually an equation, and there are two sides to it. So we want more of our practitioners to be able to support us on both of those perspectives.
And anecdotally, I have actually brought up to my doctor some of these things, and they look at me like I've got lobsters growing out of my head. I mean, it just, so you think, okay, all right, wrong audience, but now it's time for me to really do the work, do the research. Well, can't wait to have you back, but before we go, I just wanted to make sure that our viewers know that you do have a podcast that's just been released. How do people find it? What's it called?
You can find it anywhere you listen to podcasts, such as Apple Podcasts, and it's called The Bridge, a transformational health podcast with Dr. Elizabeth Rodgers. And there's going to be amazing guests and a lot of support.
A lot to learn. Thank you so much. Really appreciate it. We'll see you next time. We're back in 2 minutes.